Bismillah Rahman Rahim. Assalamu alaikum. Have you ever felt like your emotions and thoughts were on a roller coaster you could not control? What if your mind was battling two worlds at once? One filled with creativity and the other with confusion. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. I am here to shed light on mental health topics that often go unspoken. Today, we are diving into schizoaffective disorder, a condition that is misunderstood but deserves our attention. Imagine feeling the highs of mania one moment and the depths of depression the next, with vices you can't explain adding to the chaos. That's just one part of this complex condition. Millions of people in the world live with this condition, yet they often go unnoticed or unsupported. Together, we can break the stigma and spread understanding. Schizoaffective disorder is like to live in two worlds. One of the overwhelming emotions and another of vivid but confusing thoughts. That's the reality for those with schizoaffective disorder, a mental health condition we rarely talk about. Today, we are breaking the silence. Let's explore what it is, how it affects lives, and how we can create a more understanding and supportive world together. We are in the next episode of our series of discussion on psychotic disorders. In the first vlog, we learned that the major psychiatric disorders in the community are mood disorders, anxiety disorders, psychotic disorders, personality disorders, trauma-related disorders, neurodevelopmental disorders, eating disorders, and substance-related disorders. Then we started our discussion on specific disorders one by one. Initially, we had two discussion sessions to understand the mood disorders. We understood the depression, and then we discussed the bipolar disorders. Then in the anxiety disorders, we discussed generalized anxiety disorders and then panic disorders. In the last vlogs, we start our discussion on psychotic disorders, and in this In these disorders, we have discussed schizophrenia in the last one, and today we are discussing schizoaffective disorders. Let me introduce you to Sarah, a 28-year-old school art teacher who loves painting and spending time with her family. But behind her warm smile is a lifelong struggle with a condition many of us don't understand: schizoaffective disorder. Sarah's story began in her late teens when she started experiencing intense mood swings. One day, she would feel on top of the world, filled with endless energy, talking rapidly, and starting multiple art projects at once. The next week, she would find herself unable to get out of bed, consumed by hopelessness. And then there were the voices, soft at first, like whispers. They would call her name or comment on her actions. But over time, they became louder and more commanding. One day, during her manic phase, Sarah spent all her savings on art supplies she did not need. Convinced she was destined to start an art gallery that would change the world. Days later, she was hospitalized after expressing thoughts of self harm during a depressive episode. After years of struggling without answers, Sarah finally received a diagnosis: schizoaffective disorder. This condition combines features of schizophrenia, like hallucinations or delusions, with mood disorders such as bipolar disorder or depression. With the right combination of therapy, medication, and family support, Sarah began to regain control of her life. Today, she is an advocate for mental health awareness, using her art to express her journey. Sarah's story is just one of many, but it shows us that with understanding, early diagnosis, and the right support, people with schizoaffective disorder can lead meaningful and fulfilling lives. Let's work together to break the stigma and build a more compassionate world for everyone. Let's have a comprehensive overview in learning sequence. Schizoaffective disorder is a chronic mental health condition that combines features of schizophrenia such as hallucinations, delusions, and disorganized thinking with mood disorder symptoms such as mania or depression. It is often considered a hybrid condition lying at the intersection of psychotic disorders and mood disorders. Symptoms of schizoaffective disorders include psychotic symptoms and mood symptoms. Psychotic symptoms are similar to schizophrenia, and these include hallucinations, meaning hearing, seeing, are feeling things that are not there. Then delusions, believing things that are not true, even when faced with evidence. And disorganized thinking or speech, feeling difficulty in organizing thoughts, speaking in a way that's hard to understand, and social withdrawal and impaired functioning. The mood symptoms include depressive type, like persistent sadness, lack of energy, hopelessness, or suicidal thoughts. Bipolar type symptoms, like periods of mania, meaning elevated or irritable mood, increased energy, and impulsivity, alternating with depression. And there may be negative symptoms like lack of motivation, interest, or pleasure in activity. The timing of symptoms are very important. Psychotic symptoms must occur in the absence of mood symptoms for at least 2 weeks to distinguish it from a mood disorder with psychotic features. Mood symptoms are present for a substantial portion of illness. What are the causes and risk factors for this condition? The exact cause is unknown, but a combination of factors is believed to contribute. And these include genetics, brain chemistry, and environmental stressors. Regarding genetics, the family history of schizophrenia, bipolar disorder, or depression increases the risk of schizoaffective condition. Brain chemistry is important. Imbalances in neurotransmitters like dopamine and serotonin are closely related with causing schizoaffective disorder. Then environmental stressors like trauma, substance use, or significant life stress, they may trigger symptoms in predisposed individuals. How this condition can be diagnosed? Diagnosing schizoaffective disorders can be challenging, and it involves a thorough psychiatric evaluation, ruling out medical or substance related causes, and ensuring symptoms meet the criteria in the DSM 5. What about the treatment? How we treat this condition? Effective management often requires a combination of approaches, and these approaches are medications, psychotherapy, lifestyle changes and support, and at times hospitalization. In the medications, different drugs are being used. These include antipsychotics to manage psychotic symptoms, mood stabilizers for bipolar type symptoms, antidepressants for depressive episodes. Then psychotherapy has a vital role. And the psychotherapy may be in the form of cognitive behavioral therapy to address thought patterns and behaviors, the family therapy to improve support systems, and social skills training to aid in reinterrogation. Lifestyle changes and support is also very important, like stress management and techniques, regular routine and healthy lifestyle practices, support groups for shared experiences and coping strategies. This is very, very important, and we should work on it. At times, hospitalization may be needed, like in this condition, I shared with you the case history. It may be necessary during severe episodes to ensure safety and stabilization. This condition is associated with a couple of complications, and these complications include social isolation, difficulty maintaining relationships, substance abuse. They are at the increased risk of substance abuse and suicidal thoughts. There's increased risk of suicidal thoughts or behaviors in people suffering from schizoaffective disorders. What about the prognosis? With proper treatment, many individuals can manage symptoms effectively and lead fulfilling lives. However, untreated or poorly managed schizoaffective disorder can significantly impact daily functioning and quality of life. Question arises, what's the difference between schizophrenia, which we discussed in the last vlog, and schizoaffective disorder, which we are discussing today? Schizophrenia and schizoaffective disorders are two distinct mental health conditions that share some similarities but also have significant differences. First, let's see the similarities between these two conditions. The psychotic symptoms. Both conditions feature psychotic symptoms such as hallucinations, delusions, and disorganized thinking. And the second similarity is the impaired cognitive function. Both conditions can affect cognitive function, including attention, memory, and decision making. What about differences? The first difference is in the mood symptoms. Schizoaffective disorder is characterized by prominent mood symptoms, such as depression or mania, which are not typically seen in the schizophrenia. Second is duration of mood symptoms. In schizoaffective disorder, mood symptoms must be present for at least 2 weeks, whereas in schizophrenia, mood symptoms are not a primary feature. The primary symptoms, the third difference. Schizophrenia is primarily characterized by psychotic symptoms, such as hallucinations and delusions, whereas schizoaffective disorder is characterized by a combination of psychotic and mood symptoms. The fourth difference is the age of onset. Schizophrenia typically develops in late adolescence or early adulthood, whereas schizoaffective disorders can develop at any age. Then there's difference between the treatment approaches. While both conditions required antipsychotic medications, schizoaffective disorder may also require mood stabilizers or antidepressants to manage mood symptoms. There's also difference between the prognosis. Schizoaffective disorder tends to have a better prognosis than schizophrenia, as mood symptoms can be more responsive to treatment. And the last difference is in that of the family history. Schizoaffective disorder is more likely to have a family history of mood disorders, whereas schizophrenia is more likely to have a family history of psychotic disorder. It is essential to note that only a qualified mental health professional can provide an accurate diagnosis and treatment plan for those two conditions, whether the schizophrenia or schizoaffective disorder. Schizoaffective disorder is more than a diagnosis. It's a lived experience that deserves understanding, empathy, and action. Let's break the stigma by embracing the stories behind label. Whether you are a patient, a caregiver, or just someone looking to understand, remember mental health matters to all of us. Let's keep the conversation going because awareness is the first step towards change. Thank you for watching and don't forget to like and share. Together we can make a difference. It's Khudafiz. See you in the next vlog.